Joy to me is being worry and stress-free.
Knowing that you're stronger with two than you are with one.
I know that I'm not alone.
That the most important thing is you have to have hope, you have to have faith.
That empty hole started to fill, and he was my only hope. I've never felt so at peace and completely whole at the same time.
In Fairfield County, something new comes across my desk every day. Crimes are committed, cases are solved, and a community is made safe by the hardworking employees of the Fairfield County Sheriff's Office. Welcome to This Week with Sheriff Dave Phelan, a weekly program here on LSN Television. We're also carried by a number of radio affiliates here in Lancaster. Do appreciate you, the viewers and listeners, that join us each and every week, and certainly our friends over at Time Warner and all the people behind the scenes that make this program possible, our executive producer Kelly Roberts, and certainly the students and staff here at the Fairfield Christian Academy where this program is actually taped. Back by popular demand, second week is Thomas Vajen, our
Good morning, Sheriff.
Jail physician, and wears a lot of different hats. Appreciate you being back. I know you're busy.
You're welcome.
And for the folks that may have missed last week's program, just tell us a little bit about some of your areas of responsibility.
Okay, my areas of responsibility, I am an emergency physician by training, boarded in emergency medicine. I also have family practice boards. And by the way, we have to take these board certifications every 10 years, and I've done them many times. And I take the same boards the 28-year-old bright guys and gals coming out of training take. And I also am a Fairfield County coroner. I have been certified in addiction medicine, which has become a specialty. And I also am a hospice physician and certified in hospice and palliative care medicine.
Okay.
So we do all those things, and actually they're separate, but they're really tied together in the end, taking care of the suffering of the human being.
Now, one thing we wanted to make sure we spent enough time this week is your responsibilities and what you're seeing within the Fairfield County Jail as far as the medical needs of our inmates.
Okay. I have been a jail physician since 1991. I'll tell you a little story because it was surprise. I get a phone call Monday morning about 6 a.m. after Dr. Hodgson, who was our former coroner, passed away, unfortunately. And they said, Dr. Vajen, yes, you got to do jail rounds. I go, what do you mean jail rounds? Well, Dr. Hodgson was the jail physician. I go, oh, I didn't know that. So I said, okay, I'll come in. So I went in and did jail rounds for a couple weeks, and I said, I really do not have the time to do this, so I'm going to try to find another individual. So I did find another doctor who had worked with me, and he did 3 weeks. He says, I really can't take this, you got it. So I had 3 weeks off, and I've been on since.
Well, and back then, though, the jail population wasn't anything like it is today, was it?
Yes, and that's another sad social story. We would have maybe 50, 60, 70 individuals in the jail. Out of that number, we might have 5, 6, 7, or 8 females. And oftentimes in December, through the kindness of the judges and the lack of crime severity, the females would get sent home, and we'd actually be down to 0 females. Which was a wonderful thing. Now, unfortunately, we carry a population of 60 to 80 females generally, and unfortunately, 90% plus of these are drug-related incidents, and that's why they're there.
And it seems to me that a lot of people that are in the jail they come in with poor health. They're addicted to drugs, and so it's even, and some of them probably, and you can answer this better than myself, haven't seen a doctor in a while.
That is true. They did not see physicians. They did not care for themselves. I can tell you a very sad story. I had one lady I took care of a few years ago, and she came to see me in medical. I said, didn't I just see you 2 weeks ago? Yes. I said, well, did you get out and come back? She says, I got out and come back. And I said, well, how long were you out? 9 days. And I looked at her, and I could tell from seeing her the 2 weeks before that nutritionally she looked very, very sad. I said, well, what did you eat when you're out? And her face just dropped. She said, oh my God, I never ate a meal. And she hadn't even thought about that until I asked her that question. So nutritionally, yes, it's unbelievably poor. And that's why most of the drug-addicted inmates, I start them on multivitamins, and actually usually not 1 but 2 a day because they are so nutritionally deficient.
And certainly there's a large percentage that have mental issues along with
Yes, probably 70 to 80% of the individuals are what we call self-medicating with alcohol or drugs because they do have mental issues that need addressed, and they either can't afford medical care, or they haven't been consistent, they've been non-compliant for one reason or another, or their transportation isn't there, or they've lost a job, or all the things that happen.
And what
to some of the
and
people
share
in our
with
society.
share with everyone the process of someone that comes into the jail, and how do they kind of get hooked up with you, and how does that work?
Okay, well, when an inmate enters, they have a little orientation. One of those things is they can fill out a sick call slip to see the physician. Now, they do that, but if they're in needs that day or that night, I get called. Our nursing personnel covers that, or the deputies call me, see fit to call me, which is great. The deputies are great about that. And they call me, and we address things right away, like within hours of them coming. A couple of situations that need to be addressed right away are the alcohol withdrawal people, because when you drink alcohol on a regular basis in a large amount, you can go into what we call DTs, or delirium tremens. If you go into true DTs, where you get confused and have tremors and become what we call psychotic, you can have a 25% death rate from that. So that's something we address very quickly and right up front. It helps if someone tells us they're drinking, and we've had people who swear they have not drank and they're not drinkers. And sometimes we find out from a family member. So that's always a challenge. The other people that are very big challenges are, of course, someone who is suicidal or under the influence of drugs and alcohol, and psychotic as well. And the other category is those that are dependent on what we call benzodiazepines, like Valium, Xanax, Librium, those kinds of things. And when they withdraw about day 5 or 6, they can become very confused, very psychotic, and actually sometimes need ICU admission. Now we, because of my experience in emergency medicine, usually are very good at withdrawing people if we recognize them soon enough and able to recognize them, and if they give us some information. We always have to ask them 2 or 3 times, because when they come in, they're feeling guilty and they don't want to tell you anything. If they develop the severe symptoms, then we do admit them, and usually it's to the intensive care unit.
Is there any common denominators as far as the type of issues that you see with them, as far as health issues?
Well, people usually have weight loss. They have lots of abscesses with what we call the MRSA, or methicillin-resistant staph. They get these big boils on their bodies. I mean, sometimes people come in with 20 or 30 boils on their bodies. And frankly, if I saw them in the emergency department, we would admit them, but these people, because of their crimes, can't be admitted oftentimes. So we're very aggressive and treat them with double doses of antibiotics, sometimes 2 antibiotics, and always nutritional things as well. We are aggressive that way. Now, some of them end up getting abscesses in their body, and we've had a few that it goes to the heart. They get heart valve infections. Some of them have had heart valve surgery because of these infections, and then unfortunately become addicted again. And so this is a very difficult conundrum for society and for the medical world, because these heart surgeries cost hundreds of thousands of dollars, and then you have someone going back to drugs and getting addicted again, and it's a very heavy resource-laden disease.
It seems to me that there's probably been a lot of people that, had they not been in jail, they would have never been diagnosed, and they may have been in a far worse situation had they not been in jail.
And that is true. We do try to link people with agencies when they get out. For example, New Horizons is very good working with us. Drug Court's good working with us. The Recovery Center, we try to link people there. It's not perfect, but it's certainly better than it was 5 years ago, and I want it better every year that we are in existence. I want it to get better and better. We need that, and you need the whole team, because you can't just address an addiction with one pill or one counseling session. It needs support from families, friends, regular counseling, compliance, sometimes medications, and lots of energy and time from the entire medical system to get success with that.
And I've often thought that the deputies that are inside the jail, that work inside the jail, it's probably one of the least appreciated and one of the toughest jobs within the sheriff's office, dealing with these prisoners day in and day out with a host of different issues.
It is very difficult. The deputies are phenomenal, and they have to be special people to deal with them. Oftentimes when these people are healing or becoming undepressed or coming off drugs, they're very verbally abusive. They're not kind and not feeling good about themselves. And when they're not feeling good about themselves, they're not going to let others around them feel good either. So this is something that the deputies work with, and we see in many of the people as they come around, in 7 to 10 days in medication and treatment and counseling, that they improve tremendously. And I always say, when I see a patient, I want you feeling so good you can go out and go to work every day, and that's my goal for you while you're here. So that's where we go with our medication and counseling goals.
Currently, there's 3 different jails within our county, and starting next year about this time, it's going to be one under one roof, which is going to certainly help everyone.
It'll help everyone, yes. We're looking forward to that. We currently have really one semi-adequate medical facility in one of the jails, and the others are very short. Now we'll have one medical facility that will be much more adequate, and it will be much more efficient in our care and rendering care. For example, I had someone today I saw who injured their hand in an altercation, and they're out in our country jail. So to get x-rays, we have to transport them in. It takes time, energy, and money, taxpayers' money, to do that. So there's going to be savings like that we'll see where we can have those kinds of things happen at that facility without having extra man-hour and people cost.
And the other thing that really surprises me, since we deal with so many prisoners in and out of the jail every year, although we have some isolated incidents here and there, by and large, things go pretty well. I mean, I don't get a lot of calls from, parents saying, no one took care of my son or daughter. So it seems to me that the medical care that you've overseen has just been exceptional due to the volume of people that have gone through the jail and the health needs they present.
Well, thank you. My phone is on 24 hours a day, 7 days a week.
Yeah, we call you a lot.
I get called all those different hours, and that's okay. That's what I signed up for, so that's okay. I can tell actually a good story. Recently I had a note from a lady. She says, Dr. Vajen, I don't know if you remember me or not, but I saw you 2 years ago in the jail, and you talked to me and treated me like a real person, and I was on drugs at that time, and you said you really need to get your head together, and you can do it, and you don't belong here, and that kind of pep talk. And she says, I want you to know that I've been 18 months without drugs. I'm back with my family, and I'm doing well. I want to thank you for that.
What a great story to end with. Dr. Thomas Vajen, our jail physician, and appreciate all the work you do.
Oh, thank you.
And we're going to have you back again. This has been two interesting, probably one of the more interesting programs we've done on this series. And we've been doing this for, about 14 years, so great job.
Thank you.
Well, we're about out of time. Appreciate you, the viewers and listeners, and certainly the staff here at Fairfield Christian Academy, our executive producer, Kelly Roberts, and you, the viewers and listeners that join us each and every week. Till next week, same time, same place. If you're driving, buckle up. God bless, and we'll see you right here next week.
In 1929 in Chicago, a gentleman by the name of Marion Wade, a former minor league baseball player, started the company. It was just a moth-proofing company then. In 1952, it expanded to carpet cleaning and pioneered what is now called outsourcing. And the Sidwells wanted a community that had a lot of churches, had a lot of soccer opportunities where kids love soccer, and a good Parks and Rec department, so they chose Lancaster. And so in 1980, they moved the franchise here in Lancaster to 6th Avenue. But then in 2002, Todd George, current owner, purchased the franchise from them. And in 2004, he bought a building that's on Mulberry Street, and that's where the franchise is located currently. I'm Jay Johnson, General Manager of ServiceMaster Clean by Todd George, where we guarantee if it's not done right the first time, we'll do it again.
ServiceMaster Clean by Todd George, 740-687-1077, 740-687-1077.